Over the last few years, the treatment landscape for acute myeloid leukemia was dramatically changed due to the introduction of many novel drugs in the marketplace, and also we have the chance of using many novel drugs and target therapy in experimental manner. So we are running many clinical trials focusing on the specific subgroups of AML in order to in some way replace the role of in the standard chemotherapy with novel agent in AML. For sure, the role of bone marrow transplantation is still there, so it's very important, but before doing the stem cell transplantation, it's important to use the right drug for the right people. So we are in some way going and in the era of novel agents, in the era of personalized medicine, so it's very important to use some of these drugs in specific categories of AML patients carrying specific cytogenetics and genetic lesion, and this is very important. And now the introduction of molecular biology, especially of novel methodologies like NGS, next generation sequences, is allowed us to identify many genetic lesions which in some way could ameliorate the prognosis and the classification of acute leukemia. This year, in 2022, the two novel classifications were introduced in our field, in acute leukemia field, and especially the WHO classification, a European Leukemia Net classification, were able to add novel information for the classification of, for example, of secondary leukemia. So these secondary leukemia are very aggressive disease, and the recognition of this entity was in the previous classification related to the clinical data, but now is the genetic lesion fundamental for recognizing this new entity. And this aggressive entity should be treated with a novel agent like anti-ADH1 or anti-ADH2 mutant forms, or other novel drugs like midostaurin, which are so anti-FLT3 inhibitor. So we have a large array of novel class drugs which can in some way address specific subcategories of acute leukemia. So we are really living a very attractive and charming phase of our activity and daily activity due to the possibility of using novel drugs. For example, we are presenting at ASH this year some data regarding the use of novel anti-ADH1 mutant form of AML, which can in some way which proved to be very effective in inducing a long-lasting remission phase in acute myeloid leukemia patient, especially in a high-risk patient and also in elderly patient. And this is an oral agent, so it's very interesting. So we don't need to use complicated and induction therapy, which needs to be administered in hospitalized patients. So we were able to do this in outpatient, even in outpatient setting. These anti-ADH1 inhibitor drugs are very effective, especially if we combine this with azacitidine or decitabine, which are some standard agent sub-Q forms of which are effective for the control of AML. So I think that the landscape treatment for AML is changing over the last years, and it's very interesting now to test a novel agent to be used before as a bridge to transplant. This is a very important point.